Welcome back. The gift of sight is something most of us take for granted, especially when many of us wear glasses to be able to see correctly. Well, now with the help of Singer Haley Vision, premium cataract and LASIK surgery can help you achieve the vision you've always wanted without the glasses. Joining us now is Dr. Henry Haley with Singer Haley Vision. Welcome.
Well, thank you for the opportunity.
Of course. Thank you for being here this morning. So if I've been diagnosed with cataracts and I'd like to be totally free of contact lenses, reading glasses, etc., can this be accomplished?
Yes, we actually have a very high chance of achieving that goal with our modern premium or advanced cataract surgery and LASIK vision correction surgery.
This is amazing. I mean, are these technological breakthroughs in this field?
There's versions of these technologies that have been around for 20 or more years, but of course over time they've been refined and perfected considerably.
And is this safe technology?
The technology, beside the fact that it's been around for over 20 years, is safe. The new type of intraocular lenses we use are as safe as any of the previous lenses. So yes, they're very safe. We use them. Everybody that has cataract surgery gets an implant. So. Okay,
all right. So if someone is unhappy with their vision after surgery, though, what's the next step from there? Can something be done?
Well, there's a couple of reasons why that may happen. With these new lenses, one of the things is adaptation. The patient's brain actually has to get used to using these new lenses, and so it takes time. Now, sometimes it could be that the vision may be off a little bit, and if that's the case, we can usually fine-tune the vision with a laser vision correction procedure such as LASIK. Other times, in rare cases, the patient just does not adapt to these new lenses, and the good news is that we can actually exchange the implant and put in a traditional lens, which solves the problem.
Okay, and so on the table here we have an example of the inside of an eye, right?
Correct.
So can you kind of show us, where, and those are the lenses on the left there, is that right?
Correct.
Can you hold those lenses up for us and kind of show us what they look like?
These are kind of blown up images of actually the implants we put in the eye.
That'd be a very big eyeball, it's true.
We can explain the little differences, but basically there's two ways we help correct vision and get people out of glasses and contact lenses. One is laser vision correction, LASIK, which most people are familiar with.
Okay.
And in that scenario, what we're doing is actually treating the front surface of the eye, the cornea, with laser to reshape the cornea. The idea is to focus the light rays to the back of the eye on the retina into a point, and that allows you to have great vision. Now with cataract surgery, we actually go in and remove the natural lens of the eye, which is right here. It's about the size and shape of a little M&M candy in real life.
Oh, wow.
But we remove the cataract, and then because we're actually removing the natural lens of the eye, we have to replace that with an artificial lens. And most people have a standard implant which looks like this.
Okay.
But newer technology that gives you the ability to see without glasses or contact lenses involve what we call multifocal or extended depth of focus lenses, which have these little concentric rings built into the lens. And each one of these rings has a different power, and that's what gives you the ability to see everything from distance on up to near.
Wow, okay. Awesome. So, I mean, if someone's a bit nervous about the surgery, though, I mean, can you kind of tell them a little bit more about the process? I mean, you take them in and you answer all their questions for them, right?
Correct. Yeah, we have a great staff at our office, and one of the keys is just getting people comfortable with the idea of having somebody operate in their eye, which is a scary thought for most people.
Sure.
But once we have the patient prepared, we go through the whole explanation of what we can expect, what we do, and basically cataract surgery is a pretty common and easy surgery to undergo nowadays. It literally takes about 6 or 7 minutes to do the surgery. We do it under a little sedation and some anesthetic drops in the eye. Believe it or not, the patient's actually awake. They can move their eye if they want. I'm talking to them while I'm doing it.
Oh my goodness, okay.
And about 6 or 7 minutes later, it's over. The patient walks out the door. There's no stitches in the eye, no patches. They're actually using the eye immediately.
That's unbelievable. Wow. Okay, so it's really, I mean, not as scary as we may, make this out to believe, make ourselves believe,
it's just like anything. It's the fear of the unknown.
Right.
But once the patient goes through it, almost inevitably they say, wow, that was a lot easier than I thought, and I'm ready to have the second eye done.
Okay, perfect. All right. So any other additional tips for people? I mean, maybe if they're getting the LASIK surgery, how that differs? How long is that procedure?
Yeah, LASIK is totally different technology, but again, to treat, usually both eyes are done the same time in the vast majority of cases. And from start to finish, it's normally about a 10-minute procedure.
Okay.
And in that situation, the patient, again, walks out the door using their eye right away. So it's nice. The patients get to actually see the improvement immediately. There's that what they call a wow factor involved, where they they get off the table and now they can see, and probably better than they've seen forever. So it's a nice feeling and very satisfying profession to be in.
Right, definitely. You help people see again, right, it's true. And tell us about the cost involved with each of these procedures.
Of course, you know, every practice has their different price points, but we offer, as far as LASIK goes, a price starting at $7.99 per eye. And sometimes there's a customized version of that, which may increase the price up to, say, $12.99.
Sure.
And for these premium lenses, because they're not covered by insurance, a patient has a chance to upgrade to those lenses. And what we offer with that is not only the cost of the extra lens, but if they have to have a fine-tuning of the vision afterwards with laser vision correction, that's all included in the price. It's sort of a package price, one price, and that's about $29.95
Wonderful.
per eye.
Thank you so much for being here. So Singer Haley Vision has 2 offices. There's one in Metairie, the other in Gretna. For more information, you can head to their website on your screen or give them a call.